Welcome to SUU's COVID-19 documentary. I'm your host, Connor Sanders. The infectious spread of SARS-CoV-2, or the novel coronavirus, has shut down businesses, campuses, and public places around the country. This unprecedented disease has led to unprecedented changes on a local, national, and a global level. That's why we've put together this collection of stories to see how the coronavirus has impacted the economy, sports, and politics. But first, let's take a look at what one Southeastern Utah community is doing to fight the pandemic.
Did I hand the virus to you? And I handed you the mask? Hi.
Oh, I don't know. Hospitals across the nation are experiencing shortages of sterile scrubs and respiratory masks, but community members in southeastern Utah are breaking out their sewing machines to make a difference. Since March 17th, a project to resupply the Moab Regional Hospital with reusable gowns and masks has been approved by law enforcement officials and fully supported by the hospital staff. In the wake of the COVID-19 pandemic, Moab local Tammy Norman had to close the doors to her barbershop and found herself with extra time to help and an extra big heart.
So I prayed, asked for inspiration. I knew my mom's neighbor sewed. I went down to see if she would help sew some and if we could get people starting.
She called her friend at Moab Regional, who is responsible for purchasing and contracting medical supplies, to inquire what could be done to relieve the burden.
So we got pictures and talked about what they needed. I went to Crystal Day, who I know sews really well. She mocked up 2 different patterns. We took it down. They tried them on different ones. We figured out which one works, which one didn't. We had to go do some tweaking. She went back and made the corrections.
At Canyonland Quilts, owner Cheryl Meyer opened her building to the project. The facility has HEPA filters that allow more people to gather and work in closer proximity to each other while reducing the risk of contracting coronavirus. Since the local mandate was issued to shut down operations, Moab hotels have donated bed sheets and other fabrics for use in the project. Community members have rallied to the cause and have been organized into 2 teams, those who cut out the patterns from the material and those who sew them into gowns and masks. The primary objective of the project is to supply medical responders and law enforcement officials with the masks as they are on the front lines of the battle against the disease. Crystal Day's video tutorial and patent-pending pattern for the masks is available for free online, and many other hospitals and communities have also begun similar projects inspired by the Moab women.
My little brother works at the Tacoma General Hospital, and they're all running low on masks and things like that. I've heard from people as far as Pennsylvania today, and New Mexico, and Denver. People from all over the country are calling. They've been watching the video, and they're prepping and making them for themselves, for their local communities that need them, and some of them are sending them here, so we're excited to have them.
The volunteers endeavor to make between 300 to 500 sets of washable protective gear to be distributed locally. The print-to-scale pattern and tutorial is found at canyonlandquilts.com under the header Masks. Reporting from Moab, Utah, for SUTV News, I'm Race Knutson.
This is SUU's Rotunda, a normally bustling environment where students come to enjoy their lunch and enjoy their breaks. But in the time since SUU has moved to online instruction alongside other schools in the state, beginning on March 12th, this environment has been completely desolate as the school has moved to remote instruction. SUU actually fortunate in this scenario to be coming right before spring break when the announcement was made and not have to worry about that awkward transition, being able to move smoothly from spring break into the rest of the semester. But this has been the environment at SUU since that announcement was made.
The SUU Cafeteria, which has been open since spring break, is working on modified hours. It is continuing with this trend by operating from 10 a.m. to 4 p.m. every day. It looks like a ghost town due to the absence of many students as a result of COVID-19. Due to the lack of students, the cafeteria is consolidating its resources and only operating 2 sections of its food stations, with a small crew. Many students who do attend the cafeteria hope that it will open up more food stations in the near future.
I mean, to be fair, they got a decent variety already, but more would be nice.
The cafeteria is also using a full-serve system to help prevent the spread of disease. For SUTV News, I'm Anders Henningsen.
And that was the sound of the sirens from those ambulances that I hear every single morning when I wake up. Hi everybody, my name is Yuri. I'm an international student from Italy, but as you guys know, coronavirus has come. I just want to point out that quarantine is not easy. at least has not been easy for me. I've been stuck here in my room in Italy since April 1st, since the day that I got back from the United States. As soon as I reached my hometown, the Italian government sent me an email and they told me to quarantine myself inside my room for 14 days to prevent, to get my family sick, of course, and also to wait and check to see if any of the symptoms would show up. So today it's April 12th, and fortunately it's been 12 days that I've been inside my room. I didn't have the chance to get out at all. Like, the only thing that I can do is to get out from this door that you guys cannot see, but it's over there. I can only go to the restroom, do my things and then come back. I cannot have any conversation with my parents, at least directly. I can talk to them like through FaceTime or those kind of platforms. I still remember the time when my mom came at the airport to pick me up and I couldn't even hug her. Like, it's been 8 months that I wasn't even able to see my mom, and when the time came, I was able to see her, but at the same time I was not even able to hug her. So it felt it's a pretty weird situation. Quarantine has not been easy at all. The only thing that I've been doing since my quarantine has started, it has been like watching Netflix, playing video games, doing some assignments from the university, and other than that I just relaxed inside my room. I've been relaxing on my bed, and that's what and those are the things that I can do. So I'm almost done with my self-quarantine, so that means that after this I will receive a call from the Italian government saying, and also from my own doctor. They basically are gonna call me and ask me a few questions about how I'm feeling, if I had any symptoms, if I'm feeling good, and if I answer those questions in the right way, I will be able to get out of my room and kind of go back to my normal life without any restrictions at all. I will be able to hug my family for a little bit, but not for too long, because the virus might still be around. So it's gonna be a pretty complicated situation, but at least I will be able to get off my room. So that's a pretty good thing. And also one other thing that I wanted to say is that for all those people that are outside, please stay at home. That's a pretty important message, because we do not want to spread this virus around. We don't want to get other people sick. Those symptomless people that do not even know that they have the virus can spread it much more and more. So please, for those people who are being outside the whole time, please, unless it's really necessary, do not get out from your houses.
The coronavirus has forced local favorites like Cedar City's own All-American Diner to temporarily close their doors. Other restaurants in the town have had to adapt and expand their dine-out options and offer more in terms of delivery. And really, the coronavirus has made an impact at a local level that has been very difficult. Let's take a closer look at how the coronavirus has impacted local communities.
Carbon, Emery, and Grand counties are all subject to business and lodging lockdowns, but the town of Moab, located in Grand County, might suffer the largest hit, as its entire industry is based on visiting tourists. The new county ordinance requires all hotels and lodging to close, and restaurants and diners are restricted to takeout and delivery orders only. As some of the year's largest tourism events occur in March, the temporary policies have resulted in a huge hit to Moab tourism, which its economy is almost exclusively reliant upon. Moab local Brendan Henderson, who has worked as a media producer for Prestige Wellness Institute, has kept a close watch on the ongoing development of the pandemic and has shared his feelings with his large YouTube following.
But the big thing that's happened in our town is Moab's really small. It's got probably 5,000 people, and where we get a lot of our revenue and what our economy is really based off of is tourism. Driving off of that tourism is a lot of events are what bring people in. Mainly Easter Jeep Safari, car show, arts festival, stuff like that. So now our town's in a compromising position where we had to cancel those events because they're extreme mass gatherings, and they put us at risk. We've banked on tourism this whole time, that when the order came down to close the restaurants, they also had to close down the hotels. And so usually around this time, the town's bustling, and there's so many people here, you can't even turn left. But now, the hotels are closed, and so you're driving by, and parking lots that are usually filled up are just completely empty. There's not a soul. There's nobody here.
An order issued by the Southeast Utah Health Department to close campgrounds and RV parks to any new visitors prompted several properties to lock up their showers and restrooms, cutting off long-term occupants from their regular use of the facilities. In the midst of the closures, Arches and Canyonlands National Parks had remained open with a temporary cessation on collecting entrance fees. Visitor centers were closed to prevent large gatherings, and permits were not available for accessing special areas and backcountry recreation. Despite these measures, the orders from Governor Herbert restricting non-essential travel and the first confirmed case of COVID-19 in the area prompted the Southeast National Parks Group to officially close the Arches and Canyonlands National Parks to all visitation. For a town that normally receives millions of visitors over the course of a year, the recent policies enacted by city and county officials encourage all non-locals to limit or even postpone their travel in order to mitigate the effects of the virus. Moab streets are eerily empty as the self-proclaimed Adventures headquarters has effectively shut down all operations that cater to non-locals. Moab's is a sobering story of how a town thriving on hospitality can quickly become a ghost town when faced with international crisis. Reporting from Moab, Utah, for SUTVNews, I'm Race Knutson.
St. George area businesses, tourist attractions, and families are struggling to fight the daily challenges brought about by the global COVID-19 pandemic. As of April 8, 2020, according to updated reports by the Southwest Utah Public Health Department, Washington County has 27 confirmed cases of the coronavirus. In order to flatten the curve, residents of Washington County are trying their best to follow Utah Governor Gary Herbert's Stay Safe, Stay Home directive.
We won't rest until we drive down the transmission rate, because if we don't do that, then the health system will be overrun and we will have a significant, more acute problem.
Helping prevent the spread of the virus, the stay-at-home directive and social distancing has affected many local businesses. Many restaurants have adopted delivery, mobile order, or takeout options, with some even making makeshift drive-thrus. Additionally, all 4 of St. George City's golf courses have been closed. Area supermarkets, stores, and shops are all facing shortages of basic necessities like canned goods, toilet paper, and cleaning supplies. In a new directive, Governor Herbert announced on April 8th that as of April 10th, anyone 18 or older traveling into Utah via roadways or through Salt Lake City International Airport will have to fill out a travel declaration form asking if they've been tested for COVID-19 and if they've recently experienced any symptoms. The port of entry into Utah, via Interstate 15 in St. George from Arizona, will be one of the entry points where declaration is required.
While we don't know how or when the situation will end, we do know that St. George residents are doing the best with what they have. For SUTV News, I'm Caden Smith.
I am Senora Fornock, and I teach 4th grade dual immersion at Windsor Elementary in Alpine School District. Right now, teaching online is not as effective because everyone's been thrown into this so suddenly without specific training. We've had some training, but it was sudden, and so there's an art to learning how to teach online. Could it be more effective in time and with experience? Absolutely. Right now, though, it's more chaotic than anything.
We're just taking it day by day, hour by hour. It seems like my schedule changes every few hours. We get news from the state in which we have to react. We get news from our parents in which we have to react. It's actually shown me how important a live classroom is and how important a real teacher is. Especially for us, we're a high school / junior high, and we've seen a lot more problems with our 7th and 8th grade students. They're really struggling. As they get older, there's been less of a struggle. The curriculum itself, there's just absolutely no practical way to get through all of it. There's no practical way to reach the depth of the curriculum that we need to reach, which is why we appreciate that the state suspended testing. I'm glad that they were pragmatic about that and saw the writing on the wall. So basically, bottom line, we're doing everything we can. We're learning as we go. My teachers feel like they are in their first year of teaching, and I'm sure my students are feeling overwhelmed. Hopefully we're bargaining, we're going back and forth and figuring out what works best for all of our students and all of our teachers.
Since the hit of COVID-19, stores and small businesses have been running low on essential supplies such as toilet paper and water. Lynn's Marketplace in Cedar City is not exempt to this pandemic. While running low on similar essential items like toilet paper and water, other supplies run low as well, such as bleach, soup, and rice. Like many other stores, Lynn's is trying to make sure people do not take more than they need, so they have limited items per customer. Lucky for Cedar City, Lynn's has been able to still stock other essentials like bread, granola, and other canned goods. Lynn's is located on Main Street and is open later than any other grocery store in Cedar City. For SUTV News, I'm Cairo Cook.
Since moving to online instruction, places like SUU's Levitt Center have been forced to close down due to the impact of coronavirus. This mirrors places like California, New York, and Florida, who have also faced shelter-in-place orders due to the impact of COVID-19. The Levitt Center stands as a reflection of how this disease has impacted our nation as a whole.
Senators in the White House have reached an agreement on a $2 trillion stimulus package to combat economic damages as a result of the coronavirus. The package will send money to individuals, states, and businesses that are impacted by the ongoing pandemic. The package amounts to $250 billion for direct payments to individuals and families, $350 billion in small business loans, $250 billion in unemployment insurance benefits, and $500 billion in loans for companies. This stimulus package is the biggest in American history and is bigger than the United States federal budget. Administration officials hope that its effects will be even greater than the cost, potentially as much as $4 trillion.
This is a wartime level of investment into our nation.
For families and individuals that have an income of up to $75,000 per year, the stimulus package will provide a one-time $1,200 payment. This payment phases out for those who have a higher annual income and ends for those earning $99,000. Families will also receive an additional $500 per child. Unemployment benefits are being extended by 13 weeks and a 4-month enhancement of benefits. According to Democrats, this will allow workers to maintain full salaries if they are forced out of work due to the pandemic. As an added protection for workers, loans for small businesses are only available if they keep their payrolls steady. These loans will be forgiven if they continue to pay their workers through the duration of the crisis. The loans for big businesses are split into $425 billion to help broad groups and $75 billion for industry-specific loans. After complaints from Democrats, strict oversights will be implemented via an inspector general and 5-person panel appointed by Congress. On top of this, companies who receive assistance must halt stock buybacks. The Trump Organization and its businesses, as well as senior government officials, are blocked from receiving loan money under these programs. The stimulus package had gone through several rounds of haggling between Stephen Mnuchin and the United States Secretary of the Treasury and Senator Chuck Schumer, a Democrat of New York and minority leader. Democrats had blocked the initial package twice while pursuing concessions. Both Mnuchin and Schumer are happy with how the package has turned out.
Help is on the way.
Mnuchin described it as a terrific bill. Money from the stimulus package is expected to be distributed to most Americans by the end of April.
As the world struggles to combat the COVID-19 outbreak, the political response in the United States has been mixed. According to Vox, the problems began months before the outbreak. In April 2018, President Trump and his National Security Advisor John Bolton began dismantling the Pandemic Response Team, a group of experts in handling global pandemics stationed all around the world. This move, coupled with that administration's repeated calls to cut the budget for the CDC and other public health agencies, put the United States in a difficult position with fatal consequences. For months, President Trump downplayed the severity of the outbreak, missing the crucial 70-day period in which the United States could have contained the spread.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape, though.
There were false claims that anyone who wanted to be tested could be, even after turning down thousands of free tests from the World Health Organization, as well as failing to address the lack of necessary protective medical gear for healthcare professionals.
How do you go from 10 to 20 to 300,000, 10 to 20,000 masks, to 300,000, even though this is different? Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door?
Axios reported Peter Navarro, Trump's economic advisor, circulated 2 memos, one in January and another in February, warning of the risk in the United States. Despite these warnings, the Trump administration would repeatedly say the situation was under control, playing down the threat and comparing it to the flu. After the World Health Organization declared it a pandemic in mid-March, the United States government acknowledged the severity of the situation. The Trump administration has formed a White House response team and led daily press briefings. As the U.S. and world economy began to see the wear and tear of this pandemic, millions of people are without jobs and industries are struggling. Congress passed a stimulus package with the hopes of alleviating some of that struggle, but as more details come out about who is eligible for what, more and more people are concerned with how they will fare. At the same time, BuzzFeed News states that the administration has pushed forward on measures that will remove people off of food stamps, which may in turn lead sick people to going to work and spreading disease because they cannot afford to lose a paycheck. Additionally, the New York Times states that Trump and his allies have continued pushing for the repeal of the Affordable Care Act, as well as dramatically scale back Medicaid with work requirements. On a more positive note, according to the Washington Post, the Trump administration is working with insurers to eliminate co-payments for testing, stop surprise medical billing, and help expand coverage related to the coronavirus. Reporting for SUTV News, I'm Morgan Kirkston.
As of April 13th, the coronavirus's confirmed amount of cases has surpassed 1.8 million people, and 117,000 have passed away from this global pandemic. Here's a look at how the COVID-19 pandemic has made a global impact.
Images from Italy are usually a window into the past, but recently it's empty places, empty squares, and empty streets.
Probably we are learning things for the next pandemic.
An Italian doctor, Marco Verrano, was the lead author of recommendations designed to help Italian doctors prioritize COVID-19 patients when there aren't enough resources. A dilemma that the US is facing right now.
When I hear the news from colleagues and friends, for example, in New York City, I think that probably they wasted some of the advantage they had.
That advantage time to prepare, he says, a few extra days of contained measures and communities can make an exponential difference. Hospitals in Italy have been sources of infections since early cases were not recognized. Initially, only North Italy was locked down, and people fled south, likely carrying the infection. Now, a national lockdown is in place, and Italy has boosted surveillance and fines. Despite its staggering more than 15,000 deaths, Italy has shown encouraging signs this past week as the percentage increase of new infections slowed. But the country is prioritizing testing only the most severe cases, so that means many others go undetected. And Verrano says calculations including those in China have been misleading.
Number of deaths is 4 to 8 times more than the official numbers. And this is happening in Italy too. So this is those are catastrophic numbers.
But why has this disease affected Italy in such a tragic way?
The problem is that we've been the first Western country where the disease was diagnosed, and so we did not recognize cases of the disease that certainly was around at least 4 or 5 weeks before.
Dr. Giacomo Grasselli is coordinating the operations inside hospitals in the Lombardy region that is currently struggling with the demographic challenge.
The age of the population, because Italy has like one of the oldest population in the world.
The only way to slow down infections is to change the behavior, and that has not been easy. In late February, just days before he tested positive for COVID-19, this Italian politician tweeted about maintaining normality and not worrying about it.
If we leave this disease go, we will have a number of deaths which is comparable to that of the Second World War. I don't see how having hundreds of thousands of deaths can help economy. I would be draconian now, and then we will restart, as we restarted after the war.
Due to the continuous changes in the policies of various countries, many flights in the last month have been cancelled. Now the air tickets for returning to China are more like lottery tickets for international students. Some people even spent about $30,000 to buy a direct flight ticket from Los Angeles to Guangzhou. Before boarding, the crew will check the body temperature of each passenger. Basically, every passenger will wear a mask. During the flight, passengers must fill out some forms about their recent health condition. After the plane lands, it can only get off 30 people at a time, and then has to line up for the nucleic acid testing and blood drawing. Passengers with abnormal physical conditions, such as fever and cough, will take an ambulance directly to the hospital for further inspection. After a series of inspections, the ambulance will send the passengers to the designated hotel, and then the passengers need to be quarantined here for 14 days. Every day, the hotel staff will deliver food to the passengers' room. Passengers need to check their temperature before 8 a.m. and 4 p.m. every day and report it to the staff. After 14 days, the hospital will retest the passengers. If the situation is not abnormal, the passengers can return to their home. The Chinese government is very strict with epidemic prevention, which is why the number of coronavirus patients can be controlled so quickly in China. Doctors in many hospitals work at least 12 hours per day. Thanks for their hard working and contributions.
For the first time since World War II, the major American sports leagues are experiencing a work stoppage due to COVID-19. Let's take a look at some of the examples of how the coronavirus has impacted the world of sports.
And fans, due to unforeseen circumstances, the game tonight has been postponed. You are all safe.
On March 11th, the sports world was put on hold after 2 NBA players tested positive for COVID-19. One of those players was Utah Jazz star Rudy Gobert.
I wish I would have took this thing more seriously, and I hope everyone else going to do so, because we can do it together. Take care and stay safe.
The NBA suspended their season right away, and other professional leagues such as the MLB and NHL soon made the same decision.
Major League Baseball's decision to suspend spring training games and to delay the regular season and opening day will be codified. Now, at that point, there will be an announcement, and I think in that announcement we'll see that just the flurry of cancellations around the sports world today really pushed Major League Baseball to do this as recently as yesterday.
The NFL has yet to suspend their season, but has told teams they will be drafting players at the end of April from home. With the lack of live events, networks such as ESPN have taken to other forms of sports, including broadcasting NBA players competing on the popular NBA 2K games.
Great defense.
It's the Nets now.
Yes, sir. What are you doing?
Unfortunately, the financial impact has put several teams in tough positions, including laying off non-essential staff and cutting player and front office salaries.
It absolutely sets a precedent here because the league is looking toward the possibility of implementing the force majeure provision in the collective bargaining agreement, which allows them to withhold money from players based on canceling games. The league has not yet committed to paying players for that April 15th pay date that is due for them next month.
With so much uncertainty around the sports world, many American fans fear the NBA and other leagues will face cancellations. Until the coronavirus is under control, sports fans around the world are forced to be left in a limbo. For SUTV, I'm Brianna Aldridge.
Head coaches have gone back.
COVID-19 has had a huge impact on basketball teams nationwide, including SUU. I had a great opportunity to reach out to some coaches during quarantine, and here's what they had to say.
COVID-19 has had a huge impact on our women's basketball program. Our season was cut a bit short. We basically went into spring break and haven't been able to really see our girls since. We haven't been able to do spring workouts. Summer is really on hold at this point. We don't know if we're going to be able to train in the summer.
Obviously, recruiting is huge. Because of COVID-19, NCAA has put restrictions on recruiting just with on-campus and face-to-face evaluations. And then the other reason, obviously, COVID-19 has affected us just as a team aspect is because our kids are not on campus. They're taking online classes. Hence, we're not able to have spring workouts. And spring workouts are obviously a huge part of our off-season training just to get better for the next.
It was just a great time to grind together in the weight room, to have hard practices. I think hardest practices sometimes happen spring and summer, and of course leading into the season, but that preparation time with your team, just in the spring and summer, we won't be able to get that back.
I also had the opportunity to do a few over-the-phone interviews with a couple of student athletes here, and two of their biggest concerns were not being able to bond and form those friendships before their season begins. For basketball teams, this is the perfect time to be spending, time together, obviously on the court, but doing outdoor activities and things off the court that will help their friendships and relationships for the season. Another huge concern was these athletes feel like they're missing out on resources here on campus because they have to be at home, but not being able to use the weight room, not being able to spend time in the America First Event Center, and all these things just add up, and so they kind of feel overwhelmed. They're trying their best to stay at home and do at-home workouts, but they're hoping that COVID-19 will end soon and everything goes back to normal. For more information, you can visit ncaa.com. I'm Rebecca Cardenas with SUTV.
As we've seen today, the impact of coronavirus has been felt here at SUU, as well as on a global and a national scale. We'd like to remind everyone, from ourselves at SUTV and for everyone at SUU, to stay safe, stay inside, wash your hands, and let's try and combat this virus. I'm Connor Sanders. Thank you for watching.